should you consider vertebroplasty for an osteoporosis spinal fracture? Imagine waking up with sudden, sharp back pain after a minor fall or even just bending forward. If you have osteoporosis, your bones are weaker and more prone to fractures, especially in the spine. When a vertebral fracture occurs, it can cause intense pain, limit mobility, and affect your quality of life. So, you might wonder if a procedure called vertebroplasty could help. Let's explore what this treatment involves and whether it might be right for you. Vertebroplasty is a minimally invasive procedure where a doctor injects a special bone cement into the fractured vertebra. The goal is to stabilize the bone, reduce pain, and help you move more comfortably. It is usually considered for people with osteoporotic vertebral compression, fractures that cause persistent, severe pain not relieved by conservative treatments like pain medications, physical therapy, or bracing. The procedure is generally performed under local anesthesia and takes about an hour, with many patients experiencing immediate relief afterward. Research shows that vertebroplasty can provide significant pain relief and improve mobility for many patients, especially when the fracture is recent and shows signs of ongoing healing. When an MRI reveals vertebral edema, or swelling in the bone, it suggests the fracture is active and may respond well to stabilization. Studies report that between 73% and 90% of patients experience notable pain reduction and better function shortly after the procedure, with benefits lasting up to a year or more. In some cases, vertebroplasty has been shown to outperform conservative management in terms of pain relief and quality of life improvements, especially when imaging confirms a non-healing fracture. However, it's important to recognize that the benefits of vertebroplasty are not universally agreed upon. Some high-quality studies, including randomized controlled trials that used placebo procedures, found no significant difference between vertebroplasty and sham treatments in pain relief. These findings suggest that some of the pain relief patients experience might be due to placebo effects. Because of this, doctors emphasize careful patient selection and thorough evaluation before recommending the procedure. Deciding whether to have vertebroplasty involves several key factors. First, your doctor will look for persistent, localized back pain that matches the location of a fracture seen on imaging, especially if MRI shows signs of ongoing healing like edema. The timing is also important. The procedure is usually considered after several weeks of conservative treatment if your pain remains severe. Risks are generally low but can include cement leakage, infection, or new fractures in adjacent vertebrae. It's also worth considering alternative procedures like kyphoplasty, which uses a similar approach but involves creating a cavity in the bone to restore height and reduce the risk of cement leakage. From an osteoporosis management perspective, vertebroplasty is not a cure for osteoporosis itself. Instead, it should be part of a comprehensive treatment plan that includes medications, lifestyle changes, and fall prevention strategies to reduce the risk of future fractures. The goal is to manage pain and improve function while addressing the underlying bone weakness. In summary, vertebroplasty can be a helpful option for some people with osteoporotic spinal fractures, especially when conservative treatments have failed and imaging confirms an active, non-healing fracture. The decision should be personalized, considering your symptoms, imaging results, overall health, and preferences. Always consult with a healthcare professional experienced in osteoporosis and fracture management to determine if this procedure is appropriate for you. Remember, every individual's situation is unique, and careful medical guidance is essential to ensure safe and effective care.